Hi, this is Steve Shaw, physical therapist from the Norfolk Physical Therapy Center. And this is part of a series where we're going to talk to you and show you a number of interesting PT-related things. Might be new and innovative treatment techniques, it might be safety tips, it might be things that you can use as far as taking care of yourself. So I think you'll find them very informative and maybe even entertaining at times. And what we're going to talk about today is a new technique we have we're very excited about for medial collateral ligament injuries, and that's the ligament on the inside part of the knee. Now, the big one that athletes injure will be the MCL plus the ACL, and then they need surgery for that. But if you just injure the MCL, a lot of times that can be treated conservatively. And what we did is we developed a really interesting taping technique here. And I was very excited about it because we'd seen some mild strains, and I was very excited to wait for somebody who had a really bad strain or a complete rupture so that we could try this new technique on. And luckily, such a person occurred. We had somebody who was boneheaded enough to think he was 18 years old and did something up on Mount Trashmore on slippery grass on the slopes, and his foot went one way and his knee went the other, and he trashed it really good. Not the ACL though, just the MCL, and we're very excited to show you that technique. So this is a very interesting technique developed. It's kind of like a Chinese finger trap. That black mark shows where the ligament is. And what we're doing is we put base tape down to protect the skin, and we're rotating the tibia inward on the femur in the first one, and then it's counter-rotated in the opposite direction with the second piece of tape. So what will happen is you twist to where there's pain, and then you put the tape down. So in essence, you block the end ranges. So they're in between those end ranges that the tape will allow there's pain-free motion. So what's going to happen next is there's going to be a second layer put on of counter-rotated tape. And now because we have the end ranges set, you'll be able to pull pretty hard to get a good lock on it. So this is what's occurring now. There's internal rotation. And then we're going to move to the next rotation on that. And what that will do is it'll just nicely tighten that thing down so that you don't need a brace, and there's essentially no pain at all as long as you don't force the motion. Excellent technique. And the reason I can say this patient is a bonehead is it was me.